You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. I'm very glad you joined us this morning. Before I begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. We continue our show from our administrative offices and wish our friends at WHBC and our listening audience continued good health. Our guest today is Vickie Ionno, RN Health Commissioner with the City of New Philadelphia. She's been on the show before. Vickie, welcome to the show. Thanks for joining us again. We are looking forward to talking to you today.
Thank you, guys. Thanks for having me.
Okay, for the past 5 or 6 months, coronavirus or COVID-19 has dominated the news and our lives. And every time we think we know the best way to navigate COVID and what the current recommendations are, they change. Thankfully, as our leaders in our health departments learn more about this virus, adjustments are made to keep us all safe. This morning, we're going to talk with Vickie Ionno, Health Commissioner, about COVID-19, how we got here, the status today, and the picture for the future. Vickie will also address back-to-school issues and concerns. We'd like to remind our listeners that our program today will be posted on our blog and our podcast, so you can go to the App Store on your smartphone and look for Health Matters with the Medicine Center Pharmacy, and you could listen to any of our programs anytime. Please subscribe.
So, Vickie, welcome back to the show again. We always appreciate hearing what's going on down there in the big city of New Philly and Dover. Tell us a little bit about yourself, your background, and your role at New Philadelphia City Health Department and your personal life as well.
Okay, that's a lot, I think. As old as I am, I got a lot to cover. So I'm a registered nurse. I graduated from Kent State University, and I've been in public health almost 19 years now, the last 9 being a health commissioner here at the city of New Philadelphia. I'm married to my husband, Mario, for the last 39 years. We have 4 adult kids, and I always say 3 adorable grandkids. I got to say that, you know.
So you told us how long you've been in public health. Where is the New Philadelphia Health Department, and would you like to share the contact information?
Okay, so we are located downtown New Philadelphia in the City Hall, the John Knisley Municipal Center. We are on the lower level. The address is 150 East High, and it's right across the street from the courthouse, the big courthouse, and Linhart Guy Funeral Home.
So let's start with the beginning. What is COVID-19 and how did it get its first start?
Well, okay, so COVID-19 is a type of coronavirus. There's others like SARS and MERS. It's a novel virus.
It's like the common cold, too, isn't it?
Yeah, common cold is also a type of coronavirus. And this one is a novel virus. It's a type of coronavirus we've never seen before. We think it started with a animal-to-human jump and then became human-to-human transmission. There's different theories and stories about it. I'm not sure we'll ever know for sure, but that is, looking at genetic studies through the science, that's the best they can come up with, is that it was a transmission from an animal to a human. And we believe it started in Wuhan, China, in a wet market. It's a market where people can walk through and buy animals live or dead, fish, those kind of things. And they keep it on ice, and it's wet there, and they call it a wet market.
Somebody's talking about this really going from China to Italy and from Italy to America. Is that sort of the game plan here, or how that got to us? Or
we're a very mobile society. I think it hopped on people contracted it and hopped on planes and moved about the world. I'm not sure that was the path. Italy did have a terrible time with the COVID virus and had a lot of loss of life in Italy, and they pretty much got it under control now. They went on a big, long lockdown, a lot longer than we've seen here in America, like 4 months before they were allowed to leave their homes. Very, very controlled. One person is allowed to leave the home to go get some groceries, not allowed outside otherwise. And it was really very strict there.
So we spread it person to person in this
person to person through the droplets, through our respiratory droplets.
Okay.
How does age play a role in the severity of COVID-19 cases?
So, what the science has showed us so far in studies of people who have contracted the COVID is that the younger aged, like children, they do really well. They don't react badly to the COVID as badly. They have some other conditions that can spin off from it that we've seen. But for the most part, children do pretty good, but they can become reservoirs and spread it to the adults in their life, and they may not fare so well.
And that's the big concern with going back to school. Would that be right?
Right. I mean, we're in a global pandemic, and it's hard to wrap our heads around this. Nothing is going to be the same or like it was for at least this year, and hopefully, we can find some answers and some vaccines to help us get back to some kind of normalcy. But for now, we have to really do our best to slow the spread. And going back to school is difficult. And kids, again, will do probably well even if they contract it, but then they take it home to parents and grandparents, and maybe the educator in their classroom may not do so good. It's really, really worrisome.
Yeah. So what's the health department's role with the school restart?
Well, the guidelines that have come out from the governor's office and from our Ohio Department of Health have mandated that schools, we gave them some guidance on how it can look to try to go back to school. And we all want our kids back at school. School is necessary for kids to learn at an optimal pace. They can do virtual, and then if they have a good support at home and are, supervised and stuff, they can do pretty well there. Some kids don't have that in their home life. School is a great place to be, but how can we do it and do it safely? So the schools came up with plans, and they were required to work with their local health department and go through those plans and see if they met the guidance that the governor and the Ohio Department of Health have put out.
So what about, you mentioned that children can be a reservoir. What other concerns are surrounding school restarts?
Well, I mean, the concerns are, there's already 4 existing walls in those classrooms. So you can't make them bigger, and to do proper social distancing, we're telling people 6 feet. Classroom sizes don't allow for it. Classrooms just are what they are. The logistics is already set. The schools have done a great job at trying to think outside the box. They're moving some classrooms outside if they can when the weather permits, and they're moving them into larger spaces like auditoriums and cafeterias, and just doing their best to create that social distance where they can.
What do you think about the psyche of the kids and all these changes, the differences, when they show up back in school? What do you think?
I'm sure some kids, depending on their personalities and if they have any developmental issues, and sometimes it is unnerving for even us adults who are educated and have a hard time adjusting to this idea of not being able to do what we want when we want. But for kids, we have to give them credit. They're very adaptable. Kids are just wonderful about being able to adapt. We don't give them enough credit sometimes. They have worries like we do as adults, and then it's our role as an adult to help, talk through that and make this a positive thing as best we can, and not always a negative, and how we hate masks or just.
My 10-year-old granddaughter shows up yesterday at like an orientation or something. Okay, so they split up the class into 3 15s. Okay, and the first comment of the principal came in, and my grandson had gone to that school before, so they kind of knew the principal. And my granddaughter's first comment was, "There's none of my friends in this class. What am I going to do?" So
it's different. And part of the plan for some of the schools that I've reviewed is that they're trying to do something called cold 14. So they're keeping the same 10 kids together as they move, if they're changing classes. So if we do have a positive case in that group of 10, we can narrow down who was a close contact. Rather than put a whole classroom in quarantine, we can narrow it down to 10 maybe, So it's a lot of uncomfortable thinking, but it has to be.
So we're hearing that most schools are going to have 1 day of sort of online and 2 days in or something like that. What's going on down in New Philly?
No, New Philly is planning on going 5 days. They polled their parents. 80% of their parents want the kids back in full time, and stated that they were willing to accept, whatever comes with that, risk-wise, I guess. And we'll see. I mean, they have Plan A, Plan B, Plan C. They're going to have to adjust if they have outbreaks, and things will change. Just as the kids who just moved to college, and already a lot of them have been sent home because of outbreaks.
No kidding. Wow. So full day every day of the week for them down there, huh?
For New Philadelphia, that's the way they're planning. Central Catholic High School and middle school is also planning full time, and they're going to try. They're going to try. But they have other plans in place that if something changes, they'll adapt.
Okay, interesting. Okay, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with the Health Commissioner of New Philadelphia, Vickie Ionno. We're discussing COVID impact on back to school. So, we're off screen here. We were talking about how do you think school looks this year, and how's it going to feel to everybody?
Yeah.
The one thing with many school systems is that parents have to either go daycare or do something. And, on some of these days where the kids aren't in school, and that really kind of gives them a real different twist.
Yeah, it sure does. There a lot of parents, are really invested and make huge efforts. And then, of course, we have some households where there's some dysfunction, or the parents work shifts and doesn't allow them to be home with those kids, and the work sometimes doesn't get done. It's a struggle. Either way, going in person or virtually, there's struggles that come with it. It's just attitude you have to take to accomplish what needs to be done.
Okay, what about the mask controversy? It's up and down, yesterday.
Yeah, the dreaded mask conversation. It's not our culture to wear masks. It's always been associated with a bad guy or something, well, the bank robbers, So it's a new concept for us to adapt to. Here's how I say it. We all basically have three tools in our COVID toolbox. We have three tools. And right now, we have social distancing. We have facial covering to block our droplets. And we have hand hygiene, sanitizing and washing hands. And that's it. That's it. So how do we move about return to some kind of normalcy, especially restarting in schools, and stay safe and try to prevent outbreaks? So, that's what we're trying to do, work with the school systems to help them try to go back to school, try to condition kids and families to wear that facial covering, and just simply block droplets, So the facial covering is a hot topic. They're not comfortable to wear. They're not easy. People who have any kind of anxiety or claustrophobia, it's a little hard. You do get better at it. The more I'll test to that, because I had a hard time too wearing it a lot. I'm in my office alone right now, but otherwise I have it on here at work. If I interact with anyone, I have it on. You have to have it on to wear it in our building here, just as you will when the kids return to school. So I think, helping the kids practice wearing it now. When I go to the grocery store, I see a lot of little kiddos with the mask on with their families. You don't recommend it to anybody under 2, of course. And the state mandated mask guidance that came out is for kids 10 and up, but then the schools are going to probably practice it kindergarten and up.
So how I could see the kids in the school. I don't like my mask. Try mine.
Yeah, yeah, right. I can see that too. And I can see little kids dropping them and losing them, and and taking them off and on. And it's just going to take practice and guidance from their parents and from the educator. And we'll have to be patient and do the best we can. But there's some new stuff coming out. There's lanyards. There's the gaiters that stay on the neck and just pull them up. If they're allowed, each school has to have their own policy developed around that. But it definitely is a hot topic. There is a few people that can't tolerate it for medical reasons, and I know it's upsetting, but asthma is not one of them. So many people will use asthma, but yeah, you do have bouts of asthma. It makes you hard to breathe. If you're not in an asthmatic state, it's not really a reason not to have it on to block your droplets. And there's very comfortable ones and things you just have to try until you find the one you feel more comfortable in.
Okay. How about we talk about face shields? That can be a hot topic too. And I guess I have mixed emotions personally with face shields. I can see, if you're a dental hygienist or a dentist and you're working on someone within a foot or two, and you're trying to make sure you don't get sprayed in the eyes or on the face beyond your mask, that makes sense. But what can it do for us for COVID, or can it?
Okay, so the governor released a guidance just this past week that said face shields are not acceptable wear in the school setting, except in certain situations like they're working with kids with disability, or the kids need to be able to see their mouth, like in a class that is non-English speaking that's trying to learn English. They need to see the mouth and how the words are formed. There is some special situations in which the mask is acceptable, but as a norm, it does not replace the facial covering. It does help with blocking virus attaching to the eyes if they're working with someone who is infected and is talking, sneezing, coughing. That's going to fly it toward your face and maybe attach to your eyes. So that is useful. I think when people can't tolerate facial coverings, that's an option. So they still are blocking droplets. The most important thing I can say, though, is so many people don't wear them properly. They don't wear their facial coverings properly either. It has to cover the nose and the mouth, or it's really not doing anybody any good. I mean, you're still blowing droplets out your nose, and you're still inhaling possible droplets up your nose if your nose is hanging out. And the same thing with shields. It should come below the chin to be effective. I see people wearing them where their mouth it's above where their mouth is. They're sticking out more than down. So that's just education, just trying to teach people the proper way to protect themselves and to protect others from them. Remember, wearing facial shields, facial coverings, we are doing it to protect others from us. And when others do it, they're protecting us from them. You never know when someone's infected. Often people don't have symptoms, or they don't have the typical symptoms that we think of.
Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
Special event at Studio Arts and Glass, September 11th and 12th. Fall Festival of Art combined with our annual tag sale outside in a tent featuring local artists, pottery, glass, and jewelry. Take a class and make a dried hydrangea wreath or a glass sunflower. Enjoy a corn dog and a candied apple. Fall Festival and tent sale at Studio Arts and Glass, September 11th and 12th, 9 to 8 p.m. on 77 and Apple Grove in North Canton.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Love the show. Thank God for radio. I don't know where we'd be without it.
I listen to you daily. Your station is so informative.
News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
You are listening to Health Matters with the Medicine Center Pharmacy, and we're talking today with Vickie Ionno from New Philadelphia, and we're talking about going back to school with the COVID. So here we go.
All right, Vickie, you mentioned we had 3 tools in our survival kit for coronavirus, and it was social distancing, masks, and hand hygiene. What are the current guidelines for social distancing?
Well, when we do contact tracing, and so we'll talk about that, I think, a little later in the show, but what we're going to look at is who was around that infected person during their infectious time, and we go back 48 hours from the onset of symptoms or up to 48 hours before their positive test. And so we're looking at 6 foot is our social distancing marker. And then for more than 15 minutes, and that is not consecutive, but that is a cumulative time. So if you were interacting with someone who was infectious 5 minutes here, 5 minutes there throughout the day, and it totaled more than 15 minutes, then you increased your probability of infection.
Okay. So what about how do we do that in a classroom? So you mentioned earlier in the program we've got the walls going on. Yeah. You've got to make special arrangements. What do you suggest, or what are you seeing being done?
Right. So the American Academy of Pediatrics, they said 3 to 60 because they know classroom space just doesn't allow for 6 foot distancing typically. Now, a lot of schools in their plans have thought outside the box. They've They're splitting classes. They're moving to bigger spaces, like places you wouldn't typically have a classroom, like an auditorium or a cafeteria, or outdoors if the weather permits. So they're doing their best to do that. If they cannot, and sometimes they just cannot, there's just not space for it. We're going to look at who was in that 6-foot radius of that infected person. And it would just be more kids if they're not 6 foot apart. There's going to be more people within that 6-foot radius. So if they're 3 foot apart, it'd be double the amount of people.
Well, air movement is also an issue, and I thought it was interesting. My son's going off to college for the first time here next week, and one of their memos they put out was that they have checked the engineering controls for their classrooms and that they have at least 4 or 5 air changes an hour of the air in that room. But what do you do about a school that doesn't have air conditioning or maybe is reliant on the breeze coming in the window? How do you deal with those kind of things?
Right, and we have that. Some of our school buildings are older and they don't have air. And teachers and educators, they relied on their fans to get them through the hot months in the early fall and in late spring before school's out. And I discouraged the use of fans this year because if someone is infected and there's a virus blowing around now, that was before we had the mandate of facial coverings in the classroom. But, if there's a virus in the classroom and you're blowing around with fans, there's the potential of blowing it up a lot of noses in the classroom. With the mask, with facial coverings, that's going to help. Facial coverings more help protect others from you and not necessarily they're not airtight unless you're wearing an N95. And so there's still the opportunity for something to get in to your nose or mouth. So what the schools have done is looked at getting air exchangers or something that draws the air out of the window versus blowing it around in the classroom. So they're doing their best. I honestly think that the schools and the school administrators and boards of education are doing the best they can to keep people safe. They want school to go on and they want their kids to be safe and their educators and staff to be safe.
Okay, I have a friend who is in maintenance in one of the schools, and they're required to, shall we say, sanitize the classrooms and everything at the end of the day. What are they using? What kind of chemicals are they using?
Well, anything that's bleach-based is a good germicide that will kill this virus. The capsule around this virus is very fragile. So just the motion of scrubbing, it breaks those capsules open. That's why hand washing for 20 seconds does the trick. Whether you're using antibacterial soap or not doesn't matter. It's the actual friction of breaking those viral capsules open and then washing them down the drain. So your troubles are over when you do a good hand washing. And so sanitizing is an important piece. Because, the virus can live on surfaces. Droplets can land on the surfaces, the tabletops and desktops and things. And just the sanitizing fraction of wiping is great. Also, they're using foggers, which has a peroxide base, which is something that will kill that virus. And they have air exchangers, as you spoke of, Brad, in a lot of these school settings. So they've really stepped up their capability of sanitizing, doing deep cleaning at the end of every day, and touch points during the day.
What about the school buses?
I'm sorry?
What about the school buses?
Yeah, so school buses. That was a lot of thought had to go into school busing. The school bus drivers will be wearing facial coverings. All the kids will be required to get on the bus to wear their facial coverings from the time they get on till they get off. And that was going to be the case whether this mandate for statewide facial covering came into play. But in schools also, facial coverings became required in the school setting. But before that, the school bus drivers were going to mandate that the kids wear a facial covering while they're wearing the bus. They were going to space the rows. The kids would have assigned seating, and they would do a good cleaning, fogging on those buses after the kids, left the bus. The bus driver also will keep a chart of each child that he is to pick up, and whoever gets on the bus is marked as riding that bus. If we would have a child come up or a driver come up with COVID, become infectious with COVID, then we'll be looking at what bus that child was on, what seat they sat in, and look and see who was in that 6-foot radius around that child.
So are they going to take their temperature when they get on the bus?
The schools I'm working with have a mechanism in which they have an app that the educators, staff, and parents are reporting temperatures before they leave for school. I'm not sure. I don't remember them taking the temperature as the kids get on the bus. I don't remember that one. I think it has to be reported out before the child leaves home.
Okay. All right. Well, that's pretty interesting. With you don't think about some of these dynamics when you think about the kids sitting at the desk, and you think about the school bus and all the door handles, and it really makes you look closely at all the contact points. My
granddaughter's school, she's second grader. They have the little triangular plexiglass sitting on each desk. And they were able to work it out where the desks were 6 foot apart. And also they have the little barrier in front of their desk. So if they're behind their barrier, they could take a mass break. And they're going to need to be able to take a mass break, so will the educators and staff. So how does that look? And can they do it without exposing anybody to their droplets when they take it? And a break is just a break, a few seconds, minutes, whatever it takes to take a drink, get your drink of water or whatever it takes.
Interesting.
Yeah, the fountains will be shut off. This is drinking fountains. They will have access to fill their own water bottles at the fountains, but not drink from them because of the possibility of droplet spread. And they will be bringing their own water to school. It's just different, They're not using lockers this year. They have to pack everything in their backpacks. Most of the high schoolers have Chromebooks that they carry with them and has most everything on it anyway, but they don't carry as many books like we did in high school. But it's a lot to think of.
Okay, our final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters. We are talking with Vickie Ionno today from the New Philadelphia Health Department about the COVID virus.
All right, here's the big one for you, Vickie. What happens when there's a positive case at the school, whether it's a staff, an educator, or a student?
Okay, so that's when our role really kicks in. That is our lane. That's what we do. A positive means that we will, now let me back up. Whenever there is a person positive with COVID, the laboratory by law is mandated to report that person to the local health department in the jurisdiction where they reside. So if they reside in New Philadelphia, I will be getting that call, or my nursing director, and we begin what we call contact tracing. When it's in a school setting, we're going to contact the administrative. We have already established the contact persons in each school district that we will reach out to, and we'll have to find out what classrooms they were in, and then we'll begin our contact tracing, what bus they were on. We will have to put people in quarantine, and we'll talk about what that means here in a minute, but it's a necessary part of slowing the spread.
Okay. So you started to touch on the contact tracing. You know, I know people get very touchy about their privacy and things, and I respect that too. I don't think most people realize that any phone company, if you're carrying a cell phone, people know where you are every second of every day, whether you turn your location services on or not. So that being aside, talk about why contact tracing isn't invasive and it's in the best interest of the patient and the persons around you.
Right. So we've been doing contact tracing forever. When we have a person with tuberculosis, we're looking at it's an infectious disease that we're going to look to see who they've been near and put them on alert and possibly test them to make sure they weren't infected. We also do that with a lot of other diseases. So hepatitis B, for one, we're looking to see who could have been HIV. So contact tracing is not new for us in a health department setting. In this case, we really had to step it up because of COVID being such an infectious virus. And it's so necessary to contact trace. And it's not for any reason except to slow the spread and possibly help people identify that they are becoming infected early so they can get the right medical care and possibly save their life. So it's for the person's good to know that they've been infected or they've been in close contact to an infected case as early as possible so they can monitor their symptoms and report or seek help or call their provider as soon as they recognize it. But if you're unaware, you don't know until we contact you and let you know that you were named a close contact to someone.
So what is isolation and the difference between that and quarantine? And how long does isolation last and how long is quarantine last?
Yeah, sometimes people use those words interchangeably, but the difference is isolation is a term that we use when someone's infected and they need to isolate away from others. and that includes the people in their own house. They need to use a separate bathroom if it's available to them. They need to use sleep in a separate room away from their spouse or their children. Just do their best, stay apart, more than 6 feet apart if they're having any kind of conversation or watching TV, to try to stay isolated through their period. Isolation, typically the rule of thumb is about 10 days from the time they either began symptoms or they were tested positive. So that's the isolation period. Some people are not better after 10 days. We've had people in and out of the hospital, multiple admissions in 6 weeks before they started to make that turn. And then, of course, there's some folks that really are severely ill and on ventilators for sometimes weeks or months. So that is the scariest part, when people get to the point that they can't breathe well and they need ventilation assistance then. Quarantine then is the person who was named the close contact of a person who was infected, and they are put what we call in quarantine. Quarantine period lasts about 14 days, and the reason that is because some people take up to 14 days to start showing symptoms of infection if they did, in fact, contract it from the positive person that they were near. And so quarantine period is a 14-day period. And basically quarantine is to increase your monitoring of yourself, taking your temperature twice a day, or watching for some of those symptoms, and we didn't talk about the symptoms, but the symptoms are like, the most common we're hearing right now is a headache that will not go away. If you take pain relievers, it does not go away and continues sometimes 2 or 3 days before you start having other symptoms. Of course, cough, fever, any kind of respiratory difficulty you worry about. But some people have diarrhea and stomach pain, and some people get a pink eye. The loss of taste and smell is one of the specific ones that indicates COVID to us, because that's something we don't see in other things. A lot of people just think their allergies are kicking up, and it ends up being COVID. Some people just say, I always get sinus infections. I haven't getting another one of those, and it's COVID. I mean, it can mimic flu. It's difficult to put your finger on it. And some people have no symptoms at all, and they are infected, and they could be spreading it. So quarantine is when we contact them and say, you were named a close contact of a person who has COVID.
Okay.
Really interesting.
What's the Ohio Public Health Advisory System, and how does that affect the schools?
Okay, so about 6 weeks ago, early July, the Ohio Department of Health came up with a statewide public health alert system, which is a way of rating each county, all 88 counties in Ohio, and how severe COVID is in their county. And they instead of holding the whole state under the same requirements and guidelines, they're letting some areas are not so bad, other areas are really bad, and so they're just rating each county, and it's in 4 colors. And the colors are determined by 7, what they call 7 indicators, 7 things that could be going on that could indicate how bad or good COVID spread is in your area. And when you are rated, you're rated by 4 colors. So they're yellow being the least severe spread, then orange, and then the next one is red. Before we had the statewide mandate of masks, when you became a red county, you become a county that had to have masks in any public space. And then the worst is purple. And purple is where none of us want to be. And if we become a purple county, it's back to staying home.
Wow.
That means it's very, very severe in our area.
Okay, we're out of time. We need more time. We're out of time. Okay. Thank you very much, Vickie Ionno, RN, Health Commissioner for the City of New Philadelphia. We would like to remind our listeners, if you suspect you have a medical issue, contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, JD, our technical producer. As always, we thank your listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you next Friday right here on the Zoom. on News Talk 1480 WHBC.
Thank you for having me. Stay safe.
Thank you.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.
Health experts are saying that carrying around face masks are going to be something similar to carrying around your phone because it's something we're just going to have to get used to.
Provided by News Talk 1480 WHBC.
1480 WHBC, John Bozica along with you as we are also on our live video stream, joined by Lieutenant Governor John Husted. Thanks for joining me today.
Great to be with you.